Good morning, this is Dr. Amir. Our subject for this week is sciatica. I want to appreciate all your likes and comments that you have left for me last week for our subject plantar fasciitis. And this week, many of you have asked if we can explain what sciatica is, which also is known as piriformis syndrome, and I'll be more than happy to explain what it is in a very basic term so a lot of patients can understand what sciatic is and how they can actually go with treatments. Now, sciatica is actually not a diagnosis per se, it's an um, explanation of what the signs and symptoms as a result of underlying condition, which are three most common cause that can cause sciatica. Number one would be a disc injury to the spinal column, in the lumbar region, which is your low back region. Number two would be degenerative changes and spinal stenosis, and number three would be piriformis syndrome. Now, um, let's talk about the disc injuries. Our disc is like jelly donuts. When we are young, our discs are hydrated, they're full of nutrients and uh, blood coming in and going out, and they are fluffy. So imagine a jelly donut having jelly inside, and that is our disc, and it is there for a lot of cushioning of our daily activity, our axial compression that happens on our spine. This can cause the disc to absorb a lot of those axial compression or shear compression, which it's not really good for the spine, but axial compression is what happens with our daily and normal activity. Now, when we do have that uh, vi- the vital kind of portion of our body, which is our disc, and they are very young and they're very hydrated, we don't have anything to worry about, but we do have to worry about if there is an extra force of axial compression coming into the spine, causing that jelly donut to actually come out of the contained surface of the disc, and that can cause an disc to touch any of the nerve roots that comes out from the spinal cord, and that irritation of that nucleus pulposus, which is called the jelly donut, the jelly inside of the donut, that irritation that's when it touches that nerve, that inflammation that cause and irritation that cause, it's one of the major cause of the sciatic pain, because that nerve that goes down in the nerve pull, and the nerve goes down and make a bigger nerve that is the sciatic nerve. The direct inflammation or compression of that nerve, which is the sciatic nerve, or any of the nerve that makes the sciatic nerve, can cause that irritation and radiation pain and sensory changes, which is sensitivity over the skin, and also that muscle weakness that a lot of patients experience that. Now that is with the disc injury. Now let's talk about the spinal stenosis. Spinal stenosis is, as I said, degenerative changes that happens normally in the spine. Our spine is like any other being, goes through a degenerative process. That degenerative process happens at the early 30s to late 30s, and for everybody is different, but a lot of people, when they get to the age 40, 45, that degeneration process are more apparent on the x-ray. And with degenerative changes comes that bone formation around the spinal column. That bone formation can make the canal that the spinal cord is contained inside to make it narrower, and that narrowing of the canal can compress on the spinal cord, and that spinal cord carries that electrical impulse that we talked to you about before, and that electrical impulse is not going to go through the nerve to go into the parts of the body, which is the lower extremities and lower part of the body muscles, and that can cause inflammation and compression over the nerve and over the sciatic nerve, and it would cause a great deal of pain, excruciating achiness over the posterior compartment of the leg and the thigh. Now, the third and the very common sciatic pain, it originates from piriformis muscle. Piriformis muscle is a muscle in a gluteal region of our body. It's a very deep gluteal region muscle. Underneath the big gluteal muscle, there are two other muscles. There's gluteus maximus, which is the first one, gluteus medius, and minimus, and underneath that is the piriformis muscle. So you can see it's very, very deep. I have a model right here which I can actually show you where that muscle is located. The muscle is located right over here. This is our back, and right over here is where the muscle is. Our sciatic nerve is the biggest nerve of the body. That comes right underneath that muscle. So you can actually understand what correlation it can have, direct correlation with that muscle and with that nerve, that if that muscle that goes right here and the nerve that goes right underneath, which is as thick as your index finger, if there is any muscle hypertrophy or any muscle spasm, can cause a direct pain and compression over that nerve, over the sciatic nerve. And that compression and that inflammation that can cause on that sciatic nerve can cause that sharp achiness going down the back of the leg, and sometimes to the side of the thigh, and stops by posterior of the knee. That's when the nerve actually turn into two branches and go in the posterior and anterior compartment of the leg. So there are many things that we can do as far as the treatment, depending on where the sciatic originates from. If the disc, we have decompression techniques that we do for disc therapy, that it's very, very highly effective. I have patients that benefit a great deal from decompression techniques, and also for localized nerve block that we can do by laser therapy. We can block those nerve signals that originate from the gluteal region or the lumbar region that would not take the pain to the brain. So there's that communication stops with getting that nerve to block that pain pattern transmission into the brain. I also would highly suggest that we get our biomechanic of the body and the spine aligned, and that misalignment can cause the difference between the two sides of the body, left and right, can be weights distributed unevenly. Any uneven distribution of the weight can cause one muscle to work extra and overuse than the other side of the body, and that can cause very much the piriformis muscle to go in a spasm and overuse activity and get hypertrophy, get bigger, and cause that compression over the sciatic nerve. So with a vast majority of treatment that is available at the clinic, we can definitely treat the patients with sciatic pain. I have patients that they had pain for 20 years plus, and they come to the clinic after 8 to 10 sessions, the pain that they had for 8 or 9 out of 10 have dropped dramatically to 1 or 2. And that I see that every day with many patients. So if you do have sciatica, if you're suffering from pain in sciatic region or in lumbar region in your low back, please do not hesitate to call us. Contact me personally by email drbanishahi@aol.com, or subscribe to our Facebook for weekly subjects that would touch base on most of the common pains and disorders and syndromes that a lot of people suffer from. And if you'd like to make an appointment to come in, I'll be more than happy to help you with that, and we'll get your pain under control and get you out of pain as fast as possible. Give us a call, 678-401-3803. Again, my name is Dr. Amir. Please stay tuned for any future videos, and it is always a pleasure to serve everyone with pain to get out of pain. It is absolutely my passion in life to get you out of pain, and I'll do everything I can to get you there. Please give us a call, 678-401-3803. Up until next time, God bless you and have a good day. Thanks.